TRCN shape memory alloy, embracing connector sternum connector is made of SMA. With superior performance, more compact size, lighter, non-magnetic and good biocompatibility. Unique self-pressing function provides a friendly operator. It is suitable for NMR. SMA sternum connector applicable to thoracotomy and internal fixation of sternum fracture. You can select 4 PCS 2H connectors or 2 PCS of 2H connectors and 1 PCS 4H connector or 2 PCS 4H connector for thoracotomy surgery. For sternum fracture based on the actual conditions of patients, use 6H connector for the fixation. Special surgical devices, hot saline and cool saline needed before surgery. Based on the patient's conditions, select the suitable model. It is recommended to prepare for 3 specifications of connectors for 1 model. Measure the sternum size. Measure the width of bilateral intercostal sternum. The sum is the actual width. Choose the connector with diameter 10%, 15% less than the inner diameter of the affected bone. Immerse it in the iced sterile saline mixture at 0.5 degrees Celsius for 3-5 minutes. After cooling down in the sterile saline, use a special extension forceps to open the embracing arms. Then open the products to the size slightly larger than the external diameter of the affected bone. Use the special sternum closing device to close the sternum. Use a clamping forceps to place the shaped product at the site of the affected bone. Cover a piece of hot gauze which has been immersed in the sterile saline at about 45 degrees Celsius to make the product restore. Pull out tenderly with a clamping forceps. Unclench the product tenderly to ensure its fixation. If necessary, cover a piece of gauze which has been immersed in iced sterile saline mixture at 0 to 5 degrees Celsius. Special devices and sterile saline needed before surgery. Make an incision to expose the affected bone to remove the osteodylis. Cover a piece of gauze immersed in iced sterile saline mixture at 0.5 degrees Celsius on the connector for at least 5 minutes. Use a special removal pliers model 2H connector for model 4HY and 6H connectors. Use a special pinch bar to unclench the connector from the affected bone. Take out the connector and suture up the incision. Through years of observations on clinical cases and comparisons to different chest closure devices, for aged patients with osteoporosis and poor cardiopulmonary function, closing the sternum through the connector can reduce incision size, prevent sternal dehiscence and reduce wound infection after surgery. By comparing the characteristics of various kinds of the products, Shape Memory Alloy Sternum Embracing Connector has absolute clinical advantages on the aspects of its design, convenient use, good biocompatibility, non-magnetic reaction, and reducing injury to intercostal nerves and vessels.